I'm sure you've heard of perineal massage, but maybe you're not really sure if it's even effective or worth doing, how you should do it, and when you should do it. We're going to break that all down, talk about what the research says, why it's kind of controversial, and what you can do to help have a good delivery. So if you're new here, I'm Dr. Brenda Heineke, and I'm a pelvic floor physical therapist on a mission of changing women's healthcare. Make sure that you like and subscribe if you want to see more videos just like this. Okay, let's dive in to perineal massage here. So first off, perineal massage, I don't have the superficial layer here. Disclaimer, it's broken. I tend to drop it a lot. So we're just gonna pretend that this is the vaginal opening here, and these are the superficial pelvic floor muscles, or layer 1 muscles. Just hang with me here. So perineal massage is targeting those muscles, the layer 1 muscles. And it's really trying to work on helping them stretch and lengthen to help prepare for childbirth. And the thought behind it is to minimize trauma or tearing, perineal tearing during a vaginal delivery. So part of the problem though is that it's controversial first because it has mixed results in the research. There have been multiple studies looking at perineal massage and they have mixed reviews. So some have results showing a benefit and others have results showing no benefit. So that's controversy number 1. It's really difficult to know, is it good or is it not? Is it worth your time or is it a waste of time? The second issue with it, and the issue within the research, is that there are a lot of different ways that you could be doing perineal massage. And there is no standardized approach. And in research, they all are doing different things. So it's really hard to compare and get results on a technique when everyone's using different techniques. I'm going to tell you what my preferred technique is, and also, if you stick around to the end, what I actually prefer much better over perineal massage for my clients, helping them prepare for delivery. So to kind of walk you through the research a little bit, part of it, some of the different techniques are this swooping. They show it oftentimes with like a thumb pulling in those muscles. So you're basically inserting the thumb about an inch in, so you're still on layer 1, and then you're giving it some stretch and swooping. Some show it on both sides at the same time. Others are just doing a sustained pressure or stretch, and others are working around the clock face. So from 3 to 9 o'clock. That's actually my preferred way if I am educating a patient on perineal massage, is sustained pressure working through the clock face. I'll tell you why. This swooping motion that a lot of the articles will look at, or a lot of providers are giving handouts with that. It's really easy to find this on Google. If you do a quick Google search, you'll see what I'm talking about. I've just found that that tends to actually irritate the muscles more than it helps the muscles. And oftentimes it's because people tend to be a little too aggressive. So a sustained stretch, sustained pressure is my preferred way for my patients. And I work through that clock face and tell them to basically spend more time on the areas that seem a little more tighter or more restricted. Now, the other issue with perineal massage is that in the research, they're doing the perineal massage, A, first off, different, which we just talked about, but B, at different times and different frequencies. So in some articles, they are just handing the patient an educational sheet on how to do perineal massage. They're not actually instructing them or walking them through it. And they're telling them to do it only maybe 3 times before delivery. It's very different on the research of how many times they've done it prior to delivery, and if they're doing it themselves or if someone is manually doing it to them. There's one research study that looked at doing perineal massage but it was only during delivery. They did it 4 times during active delivery, active labor, and they're just doing a stretch. So there's a lot of different timing of it as well. And so that's part of the problem. There's just no standardized approach. My opinion is that I think it can have benefits. Obviously, everyone is different, and there are so many factors that go into childbirth and what kind of outcomes you have. You know, there's a lot of different variables. What position you're pushing in, the position of the baby, the size of the baby, the head size of the baby, you know, if you have an epidural or not. So there's so many factors. You can't control for all of them. So that's what's challenging and what's a barrier on the research. But I think that it can definitely be helpful. But I think that what's more important is actually addressing the entire group of pelvic floor muscles. So back to my broken pelvis here. Now we're talking the whole layer 3 muscles here. So as it's shown here, the entire group. I think that what's more effective is addressing this, because all of these muscles have to stretch and lengthen in order to let baby drop down and pass through the pelvis and out. So perineal massage is one component of it, and it's only addressing layer 1. Whereas if we're doing myofascial release and doing internal, like manual hands-on work, we can actually address all layers of the pelvic floor, not just one. And it's been shown in research by yours truly here at Revitalized Physical Therapy that it does help with minimizing perineal tearing and with pushing time. So that is my preferred way of helping women prepare for childbirth. I don't just recommend perineal massage. I do think there's a lot of benefit to doing additional work on the deeper layers, and even educating them on how they can do that as well at home. But I think it really does, to get best outcomes, need to be a little more hands-on. It can't just be a sheet that you hand to the patient and hope that they're doing it right. It's not going to be as effective as if you are doing it yourself as a provider, or really teaching them and walking them through that. So if you want to see more of my videos about why we're addressing that layer 3 group of pelvic floor muscles, then check out the video below and let me know what you think in the comments. Hope you all have a great day. I'll see you on another video soon.